Hello, everyone, and welcome to Mindful Moods and Mental Grooves, an educational wellness experiencing focusing on mental health and well-being. On this episode, I am joined by Desiree Vanderlick. Desiree is the Assistant Clinical and PCIT Supervisor for the Children's Service Center in Hazleton, Pennsylvania. She has been in the field for 8 years and is certified in trauma, brief therapy, motivational interviewing, and PCIT. She also holds a master's in psychology with a military specialization and a doctorate degree in developmental psychology. Desiree, thank you so much for joining me today.
Absolutely.
I
My
really
pleasure.
appreciate it. I know when we first talked about it, we wanted to talk on the podcast and focusing on PCIT. And for listeners or watchers, they probably have no idea what that is. So
Most people don't. So PCIT is parent-child interaction therapy.
okay. And who can benefit from something of that nature?
So usually it's kiddos ages 2 to 7. A lot of times we get referrals from like preschool age kids that have a lot of behavioral issues, a lot of attention-seeking behaviors, and just parents that need an extra bit of motivation and a little oomph and resources in order to be able to better manage these attention-seeking behaviors.
So would you say it's more beneficial for the child or for the family, or is it like a 50-50?
All
All
for
of the above?
everybody involved. Yeah, absolutely. Like it makes life a whole lot less stressful for the caregivers, and then the kiddos benefit by just like not getting in trouble as much, and it helps the bond between the caregiver and the child. It just makes it an overall more pleasant experience for parenting.
Very cool. How would someone know if PCIT is the right fit for their child or family?
So like I mentioned before, usually like the before school aged kiddos, I know in my experience, a lot of psychologists don't want to do full testing without some sort of data
Sure.
that says like these behaviors are happening like at school, in the community, at home. So kids that aren't enrolled in school yet, obviously we can't have that data for them, but this is a first step of like, okay, maybe it's just tweaking the parenting style a little bit, or sometimes adoptive families that have a kiddo that has extreme behaviors,
That
like
don't
maybe,
really know the child very well.
absolutely,
Sure.
like gets to learn how to like more skills in order for them to adjust their points of view and their methods to meet the needs of this child that may be coming in with trauma, or like you said, not knowing their needs or their mental health background at all.
Does the PCIT process, like, is there a length of time, or is it just like case by case once again?
So usually it's typically 12 to 20 weeks.
Okay.
It's a weekly program. We see clients for 1 hour, usually same time, same day every week, because that consistency is important, because it is an evidence-based
Sure.
program.
Love evidence-based.
Absolutely. The data is there. The data is there. So usually 12 to 20 weeks. Sometimes it can go longer depending on the intensity of the behaviors. I've worked with kiddos that have autism that were nonverbal that needed extra steps in between in order to be able to meet their goals. So like it can go longer, but typically like it's an intensive evidence-based practice that should be done by 20 weeks for the typical kiddo.
Now, you mentioned working with nonverbal clients. Does that make things harder?
Absolutely,
I can
it
only
does.
imagine,
Yeah,
yeah.
absolutely, it does. There's a set of standards that we need to go by as the clinician. And one of those things that we look for is whether or not the caregiver can reflect what the kiddo's saying. And if you have a kiddo that's nonverbal, obviously they're not able to reflect any of
Sure.
that. So we kind of accommodate a little bit in order to be able to help them more. But I've actually had nonverbal kiddos come in that were leaving, like telling me, hey, I want a car, and
Oh my gosh.
things like that.
That is That's probably got to
Like,
be one
blew
of the
my mind.
best things about
Absolutely.
doing what you're doing
It
then,
makes
right?
me gives me
Oh
goosebumps
my
now
gosh.
thinking about it.
That's awesome. Oh my gosh.
Absolutely.
I think that and the reason I wanted to bring that up is because for a lot of people that might be watching or listening, you know, those parents with those nonverbal children, they might think, oh, this isn't going to work for me. This wouldn't even be beneficial. But as
I
you could
have
say,
proof. Come talk to me. I have a lot of successful stories on kiddos that, you know, like, it is really difficult to work with a nonverbal kiddo with autism. Like, the behaviors in themselves are really
Sure.
difficult. But this program empowers the caregiver to be able to pull out of a toolbox these things
Yeah.
that would be helpful for this family and these kiddos.
I love a good toolbox. I'm not
Absolutely.
gonna lie. Is there an age cutoff for PCIT?
So typically it goes to age 7,
Okay.
but there are accommodations for older kiddos, whether they might not.
Would that be where the nonverbal would come in, or okay?
Absolutely. So if their needs or their intellect is like lower on the age spectrum, I guess, you throwing autism in there, lower on the spectrum, like, we absolutely can do it unmodified. But sometimes it goes up to 12 years old. And for our certified therapists, like, we could do from ages 8 to 12 with just a little bit of modification on, like, the timeout procedure and things like that.
So let me ask you, why is there an age cutoff then?
So it's working with early developmental kiddos. So, like I said before, a lot of times these kids aren't in school, don't have much school experience. And the data right now, the evidence that they have, shows that it works for this age range.
Okay.
And they're just recently finding more data where now they're like, okay, we could go up to 12 years old now. So
So up until recently, it wasn't 12. What was it before that?
so 2 to 7
Oh,
is
so it was
where
7.
it started.
Now we can go to.
Yep.
Now you guys can go to 12. That's
Yep.
that's really cool. So let me ask you this question. So for parents that have said, you know, we've tried therapy before, it's not working. How can PCIT be different than, let's just say, like your traditional therapy?
Gotcha. So the structure of PCIT, like, it's a very strict structure that has been very beneficial to parents, caregivers, grandmas, like, whoever comes in and says, hey, I need help. These behaviors are super extreme. Like, they're hitting, they're kicking, they're eloping. The structure of PCIT and the consistency and generalization, like, we all know as clinicians and as the caregivers, we know what to do and what to expect because it is so structured.
Do you find yourself struggling sometimes with families that are like reluctant when it comes to that stuff, first coming in the door? And do you find like a little bit more of engagement, I guess you could say, as weeks would go on?
Absolutely. Like, I've had parents and caregivers that were kind of completely silent
Like,
the
why
first
am I
session.
here?
Like,
What do I
this
need
is
to be here?
stupid.
This
I'm
isn't
not
gonna work.
Yeah, you're telling me how to play with my kid, and I'm like, well, it's more than that. Like, I always say to caregivers, the first part of PCIT is just building that positive foundation. So often we have kids coming in where parents are ripping their hair out because they don't know how to manage these behaviors, and kids, they're looking for that negative attention because, you know, mommy might work 2 jobs and only have like 30 minutes before bed where kiddo is actually able to sit down with mom. But just giving that little bit of extra time where they can makes a huge difference. And we just want to make it as positive as possible, so we could make sure that foundation is secure before we go more in depth with a timeout procedure and getting the kiddo to be more willing to follow commands.
Well, I think you've already kind of mentioned it, but my next question was going to be, why is it important to involve families in early intervention services?
Because that's where it all starts. Like,
Right.
before school, before even coming here to Children's Service Center, like, they're with families 99% of the time, if not 100%. So that's where it all starts, and enabling those families to be able to have these skills, and like I mentioned before, that toolbox to be able to pull out of in order to help manage these behaviors and these concerns, I think is really important.
Absolutely. And I know that we've already kind of mentioned, like, families can definitely be difficult. I'm sure that the child themselves can be difficult to work with. But what important information about PCIT might be shared with a family to maybe increase the clarity and effectiveness of the intervention?
So I always tell my families that I am right there. Like literally in the next door, I see everything, I hear everything. I tell them you're not alone. Like we are there for you. You've come to the right place, and I will not give up until we see progress. So just letting them know that they're not alone, I think, is really helpful for them because, a lot of times they might feel like they're alone. I've had families come in, it's always me. I'm always the one disciplining. Well, guess what? It's not always you now. I'm here too. And I think that's helpful for them as well.
Just having like somebody as just a
That
extra
support.
person for support. That's great. Now, you mentioned, I just want to briefly touch on it. You said you're in the other room. So like, what does like a typical session look like? Well, I guess you can't say a typical session, but in general, what would it look like?
So usually at Children's Service Center here, we have in Wilkes-Barre, we have the one-way mirror where the client and caregiver is on one side with
Okay.
a little earpiece in.
Oh, they got an
I'm on the
earpiece.
other
Oh,
side.
okay.
Yeah, I'm on the other side with a little bitty microphone and
Okay.
like watching the whole time, like encouraging the parent, like, they're throwing a tantrum over there. It's okay. Like, just ignore it. Play with the toys on the table. Then kiddo notices, hey, I'm not getting the attention. So goes to play with the parent at the table. So I'm right in their ear. In Honesdale and in Hazleton, we actually have a camera
Both
system.
in Pennsylvania, by the way, guys.
Yes,
Both in Pennsylvania.
Pennsylvania. They have a camera set up where we have a computer monitor
Okay.
where we could watch from right across the hall, but still
And you're
like
kind of doing
right
the same
there.
thing,
The
all
same
with
thing with the
microphones. So
microphone and the
you
walkie-talkie.
guys don't find yourselves in the room with them. It's just you're just kind of separated and coaching, I guess, if you
Yep,
want to call it that.
absolutely. Coaching
That's
is
cool.
exactly what it is. So to the kiddo, it's coming from the caregiver, like
Right.
these positive skills, like, oh, mom told me I'm doing a good job building. This is awesome. When in reality, sometimes
it's you
it's me
coaching them to say, "Hey, I need you to say this," or "I need you to do this."
Absolutely, because sometimes when behaviors are so negative, sometimes it's hard to catch the positive. So me as an outsider am able to say like, hey, he stayed in the room the whole time this time, and I was like, oh yeah, you did stay in the room the whole time. So just being that like little light bulb popping on, like that positivity.
Do you ever get like a pushback from parents when you are, talking to them like, "Hey, you should say this or do this," and they're just like, "No, I'm not doing that."
Absolutely.
Oh, okay.
Yeah.
All
And
right.
sometimes they just ignore completely and not really there.
Maybe they
but
don't
then,
hear you yet.
yeah. Well,
just
I've
kidding.
I've had situations where I'm like, "Hey, could you hear me?" Yeah, but then just completely
they're
ignore
completely
the skill.
ignoring you.
But then we work on it. We work through it. Like I said before, I won't give up on families. Like as long as they're trying, I will absolutely be there. And we have a lot of problem solving, like as a team with PCIT, like lots of resources where
I feel like team involvement is like got to be a huge component of it, making sure
Absolutely.
everybody's on the same page, all working
Absolutely.
together.
Absolutely.
Do you find I know well, I know we just talked about it, like you do find sometimes parents struggle. What about times like when they're I guess just like you said, you mentioned well, they stayed in the room the whole time. They're like, "Oh my gosh, like I didn't even
Just-
realize that they did that," So sometimes I guess parents being caught up in the moment aren't realizing that their child might actually be doing something
Doing
good.
a lot better.
How do you explain the importance of catching a child being good to parents?
So I just keep pointing out, like when they're doing better, like you did that, like you are working on that behavior and like empowering them as well, because a lot of times like they don't get the praise for being a good parent, or like a lot of times in life, if you're a parent, they're like, oh, it's your job, you shouldn't be getting praise, but helps them feel good about themselves too. And like I said, just pointing it out, being that positivity,
Sure.
and letting them know that their work and it's their work that's paying off and changing this behavior that they once said was unmanageable, but now they're able to manage it.
Do you see PCIT? I mean, just especially in the northeastern PA area with the organization you work for and the things that you guys are doing. Do you see PCIT becoming more of a takeoff kind of thing? Like it's growing, it's expanding. More families are interested. More families are willing to participate.
Absolutely. I believe 100%. Like a lot of families are going to be more on board, especially with the little ones. Like I mentioned before, we have so many families, especially in this area, where like grandparents might be raising them or they're adopted or whatever's going on in their young lives. Where they might need this extra support, a 70-year-old grandma raising a 3-year-old kiddo, like times are different now. So just
Sure.
having that little bit of extra guidance on like, okay, these are the methods that evidence suggests is more effective now, I think is beneficial. And I think more people are catching on. And our wait lists are always pretty long. We'll get them down, and then within a week they're back up
Filled right back
again.
up. Now, I mean, we're obviously only speaking on Pennsylvania, but are other states doing this type of stuff? Are they,
It is
building programs like this?
other
Or
countries are
Really?
doing this type of stuff.
Oh,
Yeah,
okay.
yeah. PCIT is like in every country,
So it's
essentially
internationally known.
international. Yeah. I was just doing a training a couple weeks ago on new therapists here at Children's Service Center, and it's on the other side of the globe in
Oh my gosh.
Australia and China. Like it's literally everywhere.
Wow.
And just keeps becoming more and more popular.
I was gonna say, for when if you just talk to, let's just say, your average family, and you said, "Hey, you are struggling with your, 2, 3, 4, 5, up to 12-year-old child. You should try PCIT." I feel like a lot of them would go, "What's that?" Because it's just not.
Absolutely.
I feel like it should be a more well-known thing. It should be recommended. It should be available readily to families, because I just talking with you about the benefits of it, I can't imagine why it wouldn't be more popular of a thing.
Absolutely. I agree 100%, and have even talked to one of our psychologists here at Children's Service Center about making PCIT a prerequisite to any sort of psychological testing for like
Wow.
autism or ADHD, because we have these kiddos coming in at 2, 3, 4, like sometimes 5 years old
Yeah.
without school experience, where the parents are like, they have ADHD, they have autism, and then they go through the program and they're completely age typical, like kiddos walking out the door after graduation.
Wow.
So like some of these behaviors present themselves as these diagnoses, but at the end of the day, by the end of PCIT, I should say, is it's like, all right, like they're typical, like we're good to go. We don't need any psychological evaluation, which I think is amazing.
Yeah, and I feel like just mentioning that right there might be more encouraging for families. I do think that there is still a very large stigma surrounded by mental health and therapy, and don't get me wrong, I think it's gotten much better over the years, and I think that an organization such as the one that you work for is doing a great job to promote that. And just Pennsylvania, we're just talking Pennsylvania, but I'm talking about worldwide. Of course, there is still that very large stigma, and I think having that little piece to it, like, hey, like, it could just be like, we just need to work on a couple things, and then they can go about their normal lives, and everything is going to be good, and they don't have
Absolutely.
to be labeled or anything like that. I think that might be more willing for parents to go, oh, well, maybe I should give it a try. Maybe I should look into it a little bit more.
Absolutely. I agree 100%, because it is like you said, the stigma is still there, and
Sure.
like a whole lot less, but still there.
Yes.
And just trying to keep the label off of kids, as you said before. Like I think it would be great for them to be able to go through the program. Then if anything is still significant, any behaviors, then absolutely we could look into further testing. But
Sure. The goal is to avoid that. Of course.
absolutely.
Of course.
Absolutely.
Well, Desiree, thank you so much for coming and talk to me. I have one more question to ask you before we get out of here. Is there anything you wish people knew more about PCIT or just therapy in general?
So I would say just try it. Like PCIT, it's so fun to watch, like as a clinician, helping these families. Like so fun to watch the kid like climbing all over the table and banging on the window or the glass, and then by the time they graduate, like they're holding the door open for you and holding hands crossing the street, and just seeing that transformation. It just makes me feel warm and fuzzy inside. So
I could imagine. I could
yeah.
just imagine that, that success and seeing the success, like, and the involvement of it, or in sessions through
Absolutely.
each week, and it's weekly sessions
It
that you
is
do.
weekly sessions. Yeah.
Just seeing throughout the weeks, just like that progression. Man, that's just amazing.
It's amazing. And like I said, to any parents that have heard about the program or caregivers, like just try it. Like I can guarantee, if nothing else, you're going to have fun with your little guy or gal, and it's going to be a good time and learning without even realizing you're learning, which I think is the best type of learning.
Absolutely, I agree with you. Desiree, thank you so much for coming to hang with me. I really appreciate it, and it was great talking with you.
Absolutely. You too. Thanks for having me.
Of course.